Pyridoxine has many vital roles in the body, and the main one is that it allows the body to use and store energy from protein and carbohydrate in food. More specifically, it functions as a coenzyme in the metabolism of amino acids and glycogen. A coenzyme is a compound that binds with an enzyme and helps speed up reactions. Another role is that it forms hemoglobin, which is the protein on red blood cells that carries oxygen throughout the body, and it's very important. It also forms the enzyme group involved in the metabolism of nerve tissue.
Vitamin B6 can be found in many forms. It can be found naturally in food, or can be added to food or taken as supplements. Pyridoxine is the most common form of vitamin found in supplements, but some supplements have its activated form, or PLP. These supplements can be taken as oral capsules, chewable tablets, or liquids. There's not a substantial difference with how different kinds of supplements are absorbed in the body, so there isn't a preference over a certain supplement over another. But compared to food, supplements are more bioavailable or more easily absorbed and used in the body. So taking B6 in the form of supplements is preferred over increasing B6 through the diet.
Pyridoxine is a water-soluble vitamin, which means that it's dissolved in water and it can't be stored in the body, so you have to intake some form of vitamin B6 every day. Some excellent sources of pyridoxine include pork, poultry, fish, whole grain cereals, eggs, starchy vegetables, soybeans, milk, peanuts, and some non-citrus fruits.
The recommended dietary allowances for vitamin B6 pyridoxine vary depending on gender and age. For males and females aged 1 to 3, their recommendation is 0.5 milligrams a day. For males and females ages 4 to 6, it's 0.9 milligrams a day. For males and females ages 7 to 10, is 1 milligram a day. For males ages 11 to 14 is 1.2 milligrams a day, and females 11 to 14 is 1 milligram a day. For males ages 15 to 18 is 1.5 milligrams a day, and for females ages 15 to 18 is 1.2 milligrams a day. And for males that are 19 and older, they should take 1.4 milligrams a day, and for females 19 and older, it should be 1.2 milligrams a day.
In order to diagnose excess B6 intake, you need a blood test which measures the serum PLP levels, since serum PLP is the primary active form of pyridoxine. To treat this, you should consume less B6 in the diet and avoid taking supplements, but the amount needed varies depending on the severity of the excess intake. Intaking excess pyridoxine can cause many adverse effects. Specifically, taking in over 200 milligrams a day chronically can cause peripheral neuropathy, which is damage of peripheral nerves resulting in pain and numbness. Chronic intake of 1 to 6 grams per day for 12 to 40 months can cause ataxia, which is a loss of muscle coordination and balance. It can also cause painful dermatological lesions, photosensitivity, gastrointestinal symptoms, and reduced ability to sense pain or extreme temperatures.
There are many symptoms of having a deficiency of pyroxidine. Some of these include seborrheic dermatitis, which is a skin condition causing scaly patches, red skin, and dandruff; glossitis, which is a swollen tongue; microcytic anemia, where small pale red blood cells are found in the peripheral areas of the body; epilepsies and seizures; depression, confusion; a weakened immune system; and in infants, you might see irritability and abnormally acute hearing and convulsive seizures. But some people with borderline or mild deficiencies may not show any of these symptoms until having the deficiencies for a few months or years. The pathologies that can cause the B6 deficiencies include end-stage renal diseases, chronic renal insufficiency, kidney diseases, alcoholism, syndromes dealing with malabsorption such as celiac disease, Crohn's disease, and ulcerative colitis, and even genetic diseases like homocystinuria, which is caused by high levels of amino acids in the body that can be toxic and damaging to the nervous system. And some ways that people can diagnose deficiencies of this vitamin are through blood tests where they measure albumin levels and serum PLP levels. And to treat it, one should consume more B6 in their diet and take supplements.
A number of studies have examined the effect of physical activity on B6 status, metabolism, and physical performance, and many of them saw little to no effect, and the effects are still unclear. Athletes who consume low levels of calories may be more prone to have a deficiency in B6, since they'll probably not meet the requirements. Theoretically, pyridoxine supplementation could enhance the aerobic performance after chronic aerobic training due to its role in hemoglobin production, since increased hemoglobin could enhance blood oxygen circulation and uptake into the muscles. It also has a role in glycogen metabolism, which could theoretically aid in the availability of glucose during exercise, which is necessary to create ATP during anaerobic and aerobic bouts of exercise. The specific study that we found was looking at the effects of folic acid and pyridoxine supplementation on migraine attacks in migraine patients. And they found that folic acid plus pyridoxine intake resulted in a significant decrease in attack frequency compared with the placebo intake.